Happy New Year! During the months of January and February, I'm going to be continuing my short series of videos on CT scans. My first video was an introduction to CT scans. That video, as well as the videos I did on intraosseous anesthesia, can be found at the bottom of this email. In this video, I'm going to discuss internal versus external resorption and show you how to differentiate between the two on a CT scan. I'll also show you a case I recently completed of endodontic therapy and root resorption repair. This is the CBCT for this patient. Let's look at the different views so we can get a better idea of the extent of the resorption. I always start by reviewing the axial image first, because this gives me a lot of good information without having to manipulate the scan very much. Here we can see the resorption has entered the mesiobuccal canal. Therefore, endodontic therapy is necessary. As we proceed down the root towards the apex, we can see there's no evidence of apical pathology or infection down at the apex. And this is very typical of teeth with resorptive lesions. The coronal view in the lower left is a front to back view. This is the mesiobuccal root, and this is the mesiolingual root. We can see the resorption is confined to the mesiobuccal root. The sagittal view on the lower right side is a view from the side of the tooth and appears to reveal the bone loss and the furcation is present as a result of the resorption. Additionally, if we look at the skeletal reconstruction, we get another good view of the resorption. Treatment options were presented to the patient, and he elected to retain the tooth. This case is best handled as a combined root canal and resorption repair in one appointment, primarily because I do not want leakage from the resorption into the mesiobuccal root while waiting to reappoint the patient to complete the surgical repair. On the left is the completed procedure. The resorption was filled with Resorption, which is a dual-cure resin-modified glass ionomer that is very biocompatible and enables the tissue to reattach to the Resorption similar to tooth structure. And on the right is the radiograph of the completed root canal and the resorptive filling. Well, that's it for this video. The next video we will look at identifying fractures through the use of the CT scan, including incipient fractures as well as vertical root fractures. See you next time.